Late Tuesday night, a power failure in our data center caused a small electrical fire and brought down, unfortunately, our reporting system. As I said yesterday, I know many Albertans are interested in the daily COVID-19 updates. Teams are working around the clock to restore all applications as quickly as possible. We appreciate your patience as we get the system running again, and we hope that all will be resolved by tomorrow. Although we do not have in-depth data available today, I hope to provide our usual data as a part of tomorrow's update. What I can tell you is that we have identified 162 new cases of COVID-19 in Alberta. This brings the total number of cases to 2,158. We have completed 2,779 tests over the last 24 hours. Sadly, I must report 2 additional deaths related to COVID-19. A male in his 70s in the Calgary zone and a female in her 80s in the North zone. I want to express my sincere condolences to the families and friends of these individuals. The scale of this pandemic means we often talk in case numbers, but we must never forget that every case is a person. Every death is a tragedy for the people who love them. I'd also like to update on several outbreaks that have garnered significant attention recently. Yesterday, I announced an outbreak had been confirmed at the Curl Lake Oil Sands project. Alberta Health Services continues to work closely with the company to implement outbreak procedures at the site. We are doing everything possible to limit the risk of transmission. My Alberta Health Services colleagues also continue to work with the operators of the Cargill meatpacking plant in High River. They have assured me all appropriate measures are being taken, and Cargill has voluntarily and fully cooperated to ensure the health and safety of staff. In addition to complying with all public health measures, Cargill has increased physical distancing between employees and slowed down the lines while ensuring meat processing can continue safely. I would like to stress to Albertans that everything that needs to be done to keep people safe in Curl and other camps and food processing facilities like Cargill is being done. I have also been asked a number of questions recently about cases in healthcare facilities. Last week, 7 staff members tested positive at the Foothills Medical Centre maternity ward. As soon as tests came back positive, health officials took immediate action to limit the spread to staff and protect patients. No patients were affected, and no new staff cases have been reported in the past week. I want to assure Albertans there is no increased risk to pregnant patients coming to the Foothills Medical Centre. The maternity units continue to be a safe and appropriate place to deliver babies and receive care. I know many Albertans have concerns about protecting hospitals and other healthcare facilities from the spread of coronavirus. I also share these concerns. This is why aggressive measures have been put in place to protect the health of staff and patients in every facility. This includes prohibiting non-essential visitors and implementing strict infection prevention and control measures. We have not yet seen the peak of COVID-19 in Alberta. It is likely that we will continue to see occasional cases in every part of Alberta, including in some healthcare settings. When cases do arise, health officials take every possible step to isolate anyone who may be exposed and to ensure there is no broader risk to any patients. It's important to remember that COVID-19 is not airborne. Only specific individuals are at risk when positive cases are identified. If patients are at risk of being exposed, we will alert Albertans. With respect to the deaths, both those deaths are in long-term care facilities. One is in the High River long-term care unit, and the other is at the Manoir du Lac retirement home. So again, emphasizing that these are our most vulnerable residents when we look at our deaths. In terms of the discussions that I've had with my colleagues at Alberta Health Services, there have been examples of locations that either are not following the orders, so some examples of gyms. I think I mentioned that maybe last week. We have seen several gyms that were wanting to keep operating despite the orders for them to close. And so there have been orders issued to several of those to make sure that they're very aware that this is a legal requirement and not a suggestion. There have also been orders issued to some restaurants that have continued to offer dine-in services despite the restrictions. I think the vast majority of businesses are following the requirements because, again, I think it's really clear that this is something that we'll be successful in if we work together in, but those odd circumstances where someone is not following the requirements, the Alberta Health Services teams are out following up on complaints and making sure that enforcement is happening with respect to businesses that are not following the rules.